This video presents the inside-out technique using the suture gripping technique, enabling withdrawal of suture from outside joint with the suture shuttle for meniscal suturing. We have no disclosure. Various meniscal repair methods, including all inside, inside-out, and outside-in techniques have been developed. However, these involve complex maneuvers and there are limitations to the suture material. One of the key points of the technique is the use of the suture gripping technique with the suture shuttle, which allows insertion of the needle into the meniscus from inside the knee and the withdrawal of the suture from outside the knee. This technique is effective for suturing the anterior portion of menisci, as the suture shuttle is more compact and flexible than the devices used in other techniques. This technique offers high accuracy, flexibility, and ease of suturing. First, we demonstrate the suture gripping technique with the suture shuttle. First, the loop of the suture shuttle is expanded, and the suture is passed through the loop. Then, the loop is closed, and the suture is gripped with the needle tip. This technique is performed outside joint during meniscal suturing. The case is a 28-year-old woman who injured her left knee several months ago. MRI showed a baguette-handled tear of the lateral meniscus. First, standard arthroscopy is performed. In this case, the lateral meniscus has a chronic baguette-handled tear, therefore, the displaced lateral meniscus is reduced and the posterior body of the meniscus and the posterior joint capsule are sutured using the all-inside technique. In the anteromedial and anterolateral portal views, the lateral meniscus has a longitudinal tear, and the meniscus is unstable. Therefore, we suture this tear using the inside-out technique with the suture shuttle. First, in the anterolateral portal view, the needle with the suture shuttle is inserted with an empty suture into the meniscotibial capsule and the extra-articular space from the anteromedial portal. Next, a number 2 Edgemont suture is gripped in the extra-articular space using the suture gripping technique of the suture shuttle. Then, the suture shuttle, gripping the Edgemont suture, is withdrawn into the joint space and inserted into the meniscus and extra-articular space. The suture shuttle loop is then expanded and the Edgemont suture is withdrawn from the loop. Finally, the suture shuttle is withdrawn into the joint space. In this case, we suture the anterior part of the lateral meniscus with 3 stitches using number 2 edge bond. After completing the desired suturing, a skin incision is made near the exit point of the edge bond suture, and the edge bond suture is passed subcutaneously through this incision. The anterior portion of the lateral meniscus is visualized from the anteromedial portal and adjusted to the appropriate tension, and the edge bond suture is tied. Finally, it ensures that the lateral meniscus is completely stable.